On behalf of the DMVA, I want to thank you for your joining us this evening. This is the fourth event in a series of 5 virtual town halls. Tonight's topic is transportation programs and resources for veterans. With me as co-host tonight are Susan Meehan, Regional Program Outreach Coordinator for Region 2, and Zach Portster, Region 2 Veteran Service Specialist. Let's start tonight off with a poll. We would like to get an idea who's joining us tonight. You will see the poll pop up very shortly. Select the option or options that best describe you. Once you select the option or options that best describe you, please click Submit to record your response. Let's give about 15 seconds to complete the poll.
So attendee, just list in there whether you're a veteran, family member, veteran, an advocate, provider, or other.
And we have a few people who have put some information in the chat, so that's good. It looks like we got a little bit of everybody. So throughout the evening, we'll have additional polls that will appear on the screen. We are asking that you take time to participate. Additionally, we will, at the end of the event, there will be an opportunity to provide your feedback via a short post-town survey, so please participate in that. The survey will appear as a link that we've placed in the chat panel. We ask that you please stay on for the entire time, not only to hear all the valuable information that our advocates and subject matter experts have to share, but we would really like to hear your feedback regarding how this event went tonight and if you found it informative. Okay, let's talk about the chat panel. That is a mechanism that you will use to ask your questions this evening. If you have a general question, please feel free to put your questions in the chat. We do have members from our team monitoring the chat throughout the evening. All participants will be able to see what is placed in the chat panel, so for this reason, we ask that you refrain from sharing personal issues or situations. If you need to speak with somebody one-on-one, please place your first name, last initial, and a good way to contact you into the chat panel. And someone will contact you within the next 3 business days. You may also feel free to contact us at the email address on the screen at any time, and we'll put that back up there. So the resource account for the PA Vet Connect program and our team monitor this account every day. For all general questions you may have this evening, feel free to use the chat panel. Our team will be answering them throughout the evening, and we will get to as many as possible. I hope at this point everyone has found their chat panel. On the top of your screen, if you have not activated the chat feature, please do so now by clicking on the icon. We are very lucky to have our subject matter experts on our panel with us tonight. Our panelists have years of knowledge. Tonight with us is Brigadier General Maureen Weigl, Deputy Adjutant General for Veterans Affairs, John Taylor, Manager, Planning and Technology from the PA Department of Transportation, Jason Lane, who is the Chief of Volunteer Services at the Lebanon VA Medical Center, and Sherry Welsh, who is the Administrator and Senior Project Manager for rabbitcares. So at this time, it is my pleasure to introduce Deputy Adjutant General for Veterans Affairs, Maureen Weigl. Brigadier General Weigl served the country for 25 years in the Army Reserves, Active Army, and National Guard components. Since retirement in 2016, she served on nonprofit boards which help veterans and spouses teach military history and remains very active in the community. Her educational background includes a bachelor's degree in political science and communications, a master's degree in business ethics, and a master of strategic studies. Ma'am, I'm going to turn it over to you right now, and if you would, please lead us in the Pledge of Allegiance.
Absolutely, my pleasure. I pledge allegiance to the flag of the United States of America and to the republic for which it serves, one nation, under God, indivisible, with liberty and justice for all.
Ma'am, the floor is yours.
Thank you, Chip. Thank you, everybody. Good evening. I'm really excited that you all joined us this evening for this very important topic. This is our 4th town hall. We're very excited to have rolled out these town halls this year, and we've received fabulous feedback on each one. Tonight is a different topic than the others. This is a topic that is becoming a growing, emergent need for all of our veterans. Pennsylvania has close to 800,000 veterans. We are the 4th largest population of veterans in the entire nation, but we have an aging population. There's over 261,000 Vietnam-era veterans. That generation of veterans have been our lifeline to support helping veterans, volunteering for transportation services with the VA, taking care of other veterans, but they're now becoming the folks we need to take care of. As this happens, we're finding that we have less volunteers for transportation, less vehicles available, and far more need. That's our dilemma today. So I'm hoping I saw on the chat boxes, caregivers, we have veterans, we have veteran advocates. I'm hoping together through this conversation and listening to all of our experts that we can understand the resources that are available to all of our veterans. We can help you find how you can get transportation needs met. And if you have questions and concerns that we're not addressing, that hopefully we can find solutions or work towards those solutions after this town hall. It's a critical issue. I've talked to county directors. I was at a training ceremony today at Penn State where we train all of our veteran service officers from all of the counties and many of the service organizations. And one of their number one needs right now is finding transportation for veterans. We have very many rural areas across the Commonwealth, and there's not much public transportation available for veterans. As veterans are aging, as more are becoming disabled, we have to figure this problem out. It's not going to go away anytime soon. In Pennsylvania, not only do we take care of all the outreach for veterans, we run 6 long-term care facilities, 6 nursing homes. I will tell you that veterans are coming to my nursing home older and sicker, and we are needing more skilled nursing beds. Many people are living at home and waiting on long waiting lists to get into my nursing homes. They need help. They need transportation to doctor's appointments. So this is a discussion we need to have. It is critically important. So I really am looking forward to our panel discussion this evening. I'm hoping you all ask the questions you need. There is not a question that is silly to ask. We need to hear what your concerns are. And if you have suggestions or if you know of other resources that we did not mention, please add that to the chat box. We want to make sure we're all learning, listening, and understanding the problems and the solutions. There's many resources available to veterans. As Chip mentioned, we have PA Vet Connect. It's our way to really reach out into all the communities to make sure we're identifying the services and resources available for veterans. This is just one way for us to have this town hall discussion, but eventually all of our partners and information will be on our website at PA Vet Connect. So I'm going to turn it back over to Chip. I look forward to the discussions. We are here to answer any questions you have. My team and I are available. We'll be reviewing the chat box. Please ask questions or provide feedback. Thank you guys so much.
Okay, thank you, ma'am. We appreciate your comments. At this time, I'd like to introduce our first panelist, who will be sharing information on the PA Department of Transportation programs. John Taylor is the Manager of Planning and Technology with the PA Department of Transportation, Bureau of Public Transportation. John is the Manager of the Planning Technology with the Planning and Project Delivery Division of the Bureau of Public Transportation. John oversees various technology initiatives of the Bureau, including Find My Ride and the statewide deployment of paratransit scheduling software. John has worked with the Bureau of Public Transportation for over 10 years, spending time in both the specialized transportation and the fixed route urban operating divisions prior to his current role. The Bureau provides funding, technical assistance, and other support to dozens of transit systems that deliver over 300 million passenger trips in Pennsylvania annually. John, I'm going to quit sharing my screen, and you can begin sharing in your presentation.
Great, thank you. Okay, thanks everyone for having me this evening. So really what I'm hoping to cover today is just talk a bit about the different public transportation services that are available across Pennsylvania that PennDOT supports, and the additional assistance programs or types of assistance that make it a little easier for people to access those services if they have additional needs and the existing service by itself isn't sufficient to meet their needs. In addition to that, I'm going to talk a bit about our Find My Ride initiative, which is a recent technology initiative that we've deployed with, again, the hope of improving the accessibility of the existing public transportation services. So to start with, I have this slide, which is really just intended to give like a high-level overview of what all PennDOT covers. And really for the purposes of this evening, I really just want to focus in on, over the left-hand side here, the 53 transit systems. So PennDOT does support 53 transit systems. We funnel a large amount of both state and federal funding to those systems that covers their capital and operating costs and allows them to provide those 300 million trips each year that you heard earlier. So other than that, I think I'll move on because obviously PennDOT does a lot more than just public transit, but public transit is a large and important part of what we do. So in Pennsylvania, there's really two primary types of public transportation service that are being offered. And the first one we'll talk about is fixed route service. And this is really what people typically think of when they hear the term public transportation. So fixed route service are like the larger buses that you see running usually in cities. In the Harrisburg area, you'll see Capital Area Transit, the large blue buses that are running up and down the streets. The characteristics of fixed route service are that it's basically planned or scheduled in advance. So the fixed route service provider will have a schedule that's published, whether you get that electronically or they'll often have pamphlets you can pick up at like their bus stops, and that'll detail like where and when that vehicle will be throughout the day. So if you know the schedule, you know, okay, if I'm standing here at the stop at this time, the bus is going to pick me up, and then I know where the subsequent stops are going to be and what time that vehicle is going to be getting there. So you can basically use that to plan out, all right, I'm going to get picked up here. I need to travel here. You might need to walk a certain distance once you get there. But that's generally how fixed route service works. And again, I think most people are familiar with that. And people hear the term public transportation, that's usually what they think of. Now, fixed route service is great. It's very efficient. Unfortunately, it really works best in urban areas, particularly in the denser the urban area, the more efficient and the more extensive the service can really be. So when you often hear the term or the thought that public transportation isn't very widespread, that's because a lot of people are thinking of fixed route service. And again, that service only really works well where you have a decent density of people who are traveling to similar areas so that it makes sense to actually run those larger vehicles to pick people up at certain places and take them where they need to go. Some other characteristics of fixed route service is it generally charges a relatively low fare to the rider. So typical fixed route fare is going to be like in the $2 range, maybe a little higher, a little lower, depending on where exactly you're talking about. So it's generally affordable by most people. But when you actually look at what that service costs, it's usually significantly more. Like if the fixed route service providers are actually charging what it costs to run that service, you'd probably be looking at the $10+ range for each person each time they're getting on the vehicle, which obviously if they're charging that much, very few people would actually use it. And the way the service is funded is that difference that isn't being taken in revenue has to be covered by public funds, whether it's state, local, or federal. In Pennsylvania, it's a combination of all three. So with that said, as I mentioned, there are additional assistance programs or services that can help people access fixed route service if, like, for example, that fare, that $2 or whatever it is, it still ends up being a financial burden. And I'll just talk briefly about some of the different programs that are available across the state to do that. So first of all, in Pennsylvania, lottery funds, as I think you're probably all aware, are dedicated to helping people, seniors. And part of what the lottery funds are doing in Pennsylvania is they allow anyone who's 65 or older to ride fixed route service for free. So the way that program works is basically if you're 65 or older, you can go to your local transit agency and fill out an application, and they'll give you a free what's called a free transit card. And once you have that card, you can travel around the state anywhere there's a fixed route service provider. That those vehicles will let you ride and board and pay no fare with that free transit card. So that's the first program. That's probably the largest program and the most ridership we see of any of the programs I'm going to mention specific to fixed route. Beyond that, there's another program it's called different things, and it's not as widespread. So the senior free transit is available across all of Pennsylvania. The next program, the reduced fare, the half fare, is really only available in urban areas. So the larger fixed route providers like in Philadelphia or Harrisburg or Erie or those types of places will participate in this, but some of the smaller, more rural providers may not, and that goes back to specific funding sources they're using. But the reduced fare or half fare program is specific to people who have a disability or people who have a Medicare. So if you have a Medicare card, you can, again, go through potentially an application process. You'll get a reduced fare card. And what that reduced fare card allows you to do, it doesn't allow you to ride for free usually, but it will give you a discount on that service. So if the fixed route fare is $2, the reduced fare fee would typically be $1 for someone with that card. The other thing I'll say about that is it's not as expansive with its coverage as the senior free transit program is. So free transit card lets you ride anytime on fixed route for free if you're 65 or older. Reduced fare usually only applies to off-peak hours, and that off-peak hours, each provider sort of determines what that is. So I guess what I'd say is I'd encourage you, if you're interested, if you have a disability, if you have Medicare and you're interested in using your local fixed route service with that discount, reach out to your local provider and just talk with them about that, and they'll guide you through how the program works and how you can apply for it, that type of thing. The next program that helps people access fixed route service at a reduced cost is the Medical Assistance Transportation Program. And this program is specific to people who have Medicaid. So the way it works is anyone who has Medicaid who's traveling to a doctor's appointment or some sort of healthcare appointment that's being covered by Medicaid, the state's responsible for helping that person get there. So if they're going to a place for that Medicaid covered healthcare appointment and they need transportation assistance and there's a fixed route service that can do that trip for them, then that MATP program will cover the fare for that person. So again, you'll probably want to start by reaching out to your local fixed route provider. In some cases, there'll be a different organization that would actually take care of that. But once you register, and you'll probably have to, in advance, tell the people when you're traveling and for what purpose. But that's another program that helps people offset the cost of riding fixed route service. The next category is just student passes, and that varies across the state. Many fixed route providers who offer service around like universities will have some sort of student pass, so the students will either ride at a discount or for free in the service. I know like Shippensburg has that, State College has that, IUP has that, and lots of other universities across the Commonwealth has that. You'll also have some situations where students who are going to grade school also will use fixed route in lieu of or in addition to regular like yellow school bus service. So you'll have that as well in some places. And finally, the last category of fixed route fare assistance would be other private entities. You'll have occasions where like a local business, maybe they have an industrial park and they have employees that are going a certain time, and they might work out a deal with the local transit provider to run a bus there, or maybe there's already a bus in the area and they'll work out a deal where they're covering the pass on behalf of their employees. So you'll have that, but again, that sort of varies by the different businesses in an area and whether or not it makes sense for them to work with the fixed route provider on that. So in addition to the programs I just mentioned, which help offset the cost of accessing the fixed route service, there's another complement to fixed route that's intended to help people with disabilities whose disability impedes their ability to actually access the service. So first of all, I'll say that fixed route service is generally accessible. So if you have a wheelchair or maybe you have another mobility device, a walker, you generally can still use a fixed route bus. Those CAT buses I mentioned, they'll lower a bit so that first step isn't as high, and they also have the ability to take on a wheelchair, and the driver will help the person in the wheelchair board. They'll help secure them if necessary. So just being in a wheelchair, just having a mobility device doesn't necessarily mean you can't use fixed route service. But with that said, there may certainly be circumstances where you can't use fixed route. It might be because, you're in a wheelchair, but you can't actually get to the bus stop. So in circumstances such as that, all the public fixed route providers across the nation actually are required to offer what's called ADA complementary paratransit, which is basically anyone with a disability who's traveling within 3/4 of a mile from a fixed route to 3/4 of a better way to say it is anyone who's traveling in a corridor 3/4 of a mile within a fixed route, so their pickup and drop off are both within 3/4 of a mile of where that fixed route service runs. The transit provider is required to basically send out a separate van that'll pick that person up and take them where they need to go. So that's what ADA complementary paratransit is. The cost for that is a little higher, but it is legally capped at no more than twice the fixed route fare. So if the bus fare for someone riding the bus would be $2, that ADA trip for someone who needs that because of their disability would be no more than $4. All right, with that, I'm going to shift gears a bit to talk about the other main type of public transportation service available across the state, which is shared ride service. So shared ride service is basically door-to-door service where a smaller vehicle usually than what you see for fixed route service, will actually go to someone's house, pick them up there, and then take them directly where they're going to go. Shared ride service is actually available in all 67 counties. We have 43 different providers who do service, and we have a number of providers. Sherry from Rabbit Transit is going to be one of the panelists later today, and she actually represents one of those providers that covers 11 counties. But bottom line, every county in the Commonwealth has a shared ride service provider, at least one. The way this service works is the public fare is actually fairly expensive because it's designed to fully cover the cost of the service. So what that translates into is a typical one-way shared ride trip will be probably in the ballpark between $20 and $30 if you're going to pay it out of pocket. But the way it actually works is everyone who's using the service pretty much has a program that's offsetting that fare. So for example, there's a senior shared ride program for people who are 65 or older, and that program is paying 85% of that $20 to $30 fare for the trip. So what that leaves the person to have to pay out of pocket is at most 15% of the total fare, but there's often additional funding sources that may offset in that 15%. So that's sort of the main difference of the funding mechanism and what the public's actually paying to access that service. It's still public transportation, that the providers are still required to make that service open to anyone who wants to use it. So it's not, I can't use this service because I don't have a disability. I can't use this service because I'm not a senior. It's just that the cost of that service is fairly high because of the different way that the funding works for it. All right. Now I'll just go a bit more in depth about the different funding streams or programs that help people access shared ride service across the Commonwealth. So as I mentioned, the biggest one is the Senior Shared Ride Program, and similar to the Senior Free Transit Program for fixed route service, anyone who's 65 or older is eligible for the Senior Shared Ride Program. And as I said, that covers 85% of the cost of that shared ride service. And again, there's often other funding streams, whether it's an area agency on aging or some other local human service type agency that often will cover a portion or all of that remaining 15% that a senior has to pay out of pocket. In addition to the Senior Shared Ride Program, many area agencies on aging across the Commonwealth will also provide some degree of funding for people in the 60 to 64 age range who need shared ride service. It really varies county to county, but there are many counties that will pay for all of the trips that someone in that age range might take. There's others that might pay for certain purposes, or there's others that might pay for people in certain circumstances, like maybe they're in a certain income bracket or something of that nature. So it really varies. So really it's the type of thing you have to work with your local provider to see what sort of assistance is available. For persons with disabilities, there are other programs available to help people access shared ride service. As I talked about previously, ADA complementary paratransit, most of that ADA complementary paratransit service is being done as shared ride. And as I said, legally, the providers aren't allowed to charge more than twice the base fixed route fare for that. So the most you'll be paying is whatever the fixed route fare would be for that same service provider doubled, which is usually going to be in the $4-ish time or range for each trip. In addition to that, there is a state program called the Persons with Disabilities Program, and that sort of picks up where that ADA complementary paratransit service drops off across the state. So the ADA service is specific to areas that have fixed route service, and they're within that 3/4 mile corridor I mentioned earlier. Persons with Disabilities is intended to pick up where that drops off for people who are under the age of 65 that have a disability, and it lets those people with disabilities access the same network that the people 65 or older are accessing through the shared ride program. The final program that's fairly large across the state for that people with disabilities are using is MHID. Although that's usually more specialized, it's usually people going to certain locations for more specific purposes. It's not used as generally as like persons with disabilities, the Persons with Disabilities Program or ADA complementary paratransit is being used, for example. But there are a fair number of trips across the state for that funding source. Similar to fixed route service, the Medical Assistance Transportation Program, which again is specific to people with Medicaid who are traveling to a Medicaid compensated healthcare appointment, does also cover shared ride service. So they pretty much have a hierarchy of what's the appropriate service type to get the person to their medical appointment. So if there's a fixed route service that runs in an area, that's going to be preferable over shared ride service because shared ride service is a lot more expensive on a per trip basis. Alternatively, if someone has a vehicle in their household and they're able to operate it, they may be required to drive the vehicle in place of using public transit, but then the MATP program will offset some of the mileage cost associated with that. So it really depends on someone's specific circumstances and what's available in the particular county with respect to MATP. Another program specific to Medicaid, and I don't know if Sherry's talking about this this evening, is a program that Rabbit Transit's actually partnering with Geisinger across the state for non-medical trips. And at a high level, the way this works is people who are choosing the managed care organization, Geisinger is their managed care organization, who have Medicaid, who have a need to travel to non-medical appointments. Rabbit's partnering with them to work with the public transportation providers across the state to cover shared ride trips for those people across the state. So it's another example of Medicaid-funded shared ride service. And finally, there is a variety of other programs across the state. In some counties, there will be veteran-specific funding for veterans who don't fall in any of these other categories that other programs exist for. But it's sort of like AAA 6064. There's not consistent across the state. It really just depends on what services are operating in certain counties. Okay, so now I want to briefly talk about the Find My Ride initiative. So first of all, Find My Ride is a new technology service that we've deployed with the intent of making these public transportation services and programs more easily accessible to people across the state. And there's really two main components as of the moment to Find My Ride. The first is Find My Ride Education, which is really just a portal that sort of summarizes what I was just going through on this presentation. So what are these services? What are the programs that fund these services? Who's eligible for them? How do I access them? And really the key part of Find My Ride Education is there's a directory. Basically, you can select the county that you live in. It'll tell you who's the fixed route service provider, if there's fixed route service, who is the shared ride provider, who's the medical assistance transportation provider. And so someone who needs these services or someone who knows someone who needs these services, but they're not really familiar with how does it actually work in my county, can use this site to find the appropriate agency, reach out to them and start talking with them about getting the person signed up so they can start using the services, or alternatively just to answer any questions they may have that the site itself aren't able to answer. The other Find My Ride service that's currently deployed is Find My Ride Apply. And what this is it allows people to apply for the programs I mentioned online. For the most part, the way the applications for these different programs work is basically that they're paper. So you reach out to the agency, they'll get you a paper application, you'll have to fill it out and then get that paper application back to them. Find My Ride Apply allows you to now apply online for these services. And the other thing it does that's kind of nice is it sort of guides you through the process. So you don't need to know, I don't need to know I'm a senior, so I have to apply for senior shared ride. And, I also have Medicaid, so I also have to apply for medical assistance transportation, and I need to know which providers to apply to. The system takes care of all that. It asks you questions like, what county do you live in? What's your date of birth? And based on that, it sort of assembles the electronic applications that actually apply to you based on your situation. Beyond that, we are looking to continue to build on Find My Ride. The next component they're going to be rolling out across the state is Find My Ride Schedule. And what that does is it allows people to actually book their shared ride trips online, or alternatively allows you to see the status of your shared ride trip you've previously booked or cancel that trip if you're not going to be able to take it. We actually do have some providers that are currently using that. Rabbit Transit is one of them in their 11 counties, and also Delgo in Delaware County is also starting to use it. And we're planning to roll that out across the rest of the state starting probably early next in 2023 at this point. Beyond that, we are also exploring creating a new MATP-specific Find My Ride service that I mentioned earlier that MATP will also pay for mileage reimbursement. We want to create like a standard service that people can use for that purpose, and we're also hoping to use it to help people get reimbursement for bus passes that MATP is going to cover. And beyond MATP, we're hoping that service will also be able to be used by other human service agencies or other funding streams that are willing to offset mileage or bus passes, but we're going to start with MATP to sort of build out what that looks like. And then once we have that established, we'll start working with other human service organizations to see how we can make that broader. That's going to be a couple years in the making, but it's something we're starting to work on. And with that, that's all I really wanted to share this evening. I have my contact information up on the screen for anyone who wants to reach out to me. But other than that, if there aren't any questions now, I'll turn it back over. Thank you.
Well, thank you for all that information, John. It's good stuff. If you unshare your screen, I will share mine. So it is time for our first poll question. That question should appear on your screen. Read the poll question, and then please choose your answer. Click submit, and we will give you about 10 to 15 seconds to make your selection. Also in the chat, I noticed that there was a question about the slide presentations. We are recording this event, and here in about 2 weeks, we will post this presentation onto YouTube, so you'll be able to go into YouTube and watch the presentation with all the slideshows. Okay, it's looking like 67% of the audience does know that public transportation is available, but it is limited. 8% say they don't know where to start or can't afford it. 15% say no, and there's 8% that say they don't know. So looks like the yes but is limited has the most votes tonight. Okay, we're going to hear some information on transportation services provided by the Federal VA. Jason Lane, who is the Chief of Voluntary Services for the Lebanon VA Medical Center. Jason is a PA native from the Lehigh Valley. He joined the VA last month after 20-plus years working in state and federal legislative offices. He focused on military and veterans casework in his last position. Currently, he is a senior chief petty officer in the Navy Reserve, drilling out of Fort Nix, New Jersey, and will pass the 19-year mark at the end of this month. So great deal there, Jason. So I'm going to stop sharing my screen, and Jason, if you want to join with your presentation, go right ahead.
Great. Thanks very much. And so I'm going to give an overview of the transportation that we have through the VA here in Lebanon at the Medical Center. And my goal tonight, again, is to give you an overview of what we have to offer. It's not anything and everything down into the weeds. And the other thing that I want to put out there is that the medical centers, they have some flexibility or discretion with their programs, so that based on the needs of the veterans and or resources, it may not be an exact mirror image across the medical centers, but they'll be similar. So. All right, this is a list of the topics that I'll be talking about tonight. The first two that I'm going to talk about, Veterans Transportation Service and our Volunteer Transportation Network. How are they similar? They are going to get veterans to their appointments. They are going to pick you up at your door and get you to the door where your appointment's going to be. And then and it's also for veterans who are able to get themselves in and out of the vehicle safely and without assistance. How they differ for the transportation service, VTS, that's going to be a VA staffer who's going to be driving that. And then they are going to take you to your appointment. It might be at the medical center. It could be at one of our community clinics, or for an authorized community care appointment. The Volunteer Transportation Network, VTN, that is volunteer driven. So the drivers are going to be volunteers, and they drive vehicles that have been donated by the DAV. And we have those posted throughout our catchment area, and they are going to bring veterans from where we have our vehicles stationed and bring them into the medical center for their appointments. The days for the drivers can be anywhere from 6 to 8 hours long. We have veterans coming from all over our catchment area, so it gets them into their appointments, and it helps meet their needs in that respect. And the only limitation there potentially is, based on the number of vehicles that we have and the number of drivers we have at any one time. During COVID, we did have some safety precautions where it reduced the capacity of our vans for the safety of the driver and of our veterans. As things have gotten better in the COVID environment, we've been able to recently increase the capacity for veterans that we can transport in our vehicles. Some of the programs for veterans do have some eligibility criteria for the travel benefit. You can see service connection for 30% or more. For those with the 0 to 20%, if they are traveling for treatment for a service-connected disability. If someone receives a VA pension, and if you're not familiar with the VA pension, those are for low-income veterans. Also, income that does not exceed the maximum pension rate. Not everybody who has an income is collecting a VA pension. And for those that serve and have served, been injured or developed a medical condition, and have applied for compensation through the VBA, they'll schedule a compensation and pension exam to make a determination ultimately for a service-connected rating, and veterans can be compensated based on that. And I realized that I may have said something a bit confusing. So the transportation that I had on the other page, that is not dependent on this eligibility criteria. You have an appointment with the VA, and you can get a ride. This is going to be for the benefits that I'm going to talk about right after this page. Special mode transportation. We pointed out that veterans that could get into the other two options safely by themselves and without assistance. If someone's going to need assistance, we want to make sure that the veteran is safe getting to their appointment. And through our transportation folks here, they can set up transportation to get them there. And it's just coordinating with their care providers to make sure that the right information's in there. Urgent care, if somebody's going to require ambulance transport, there's potential for eligibility that the VA could pay for that. And obviously the critical piece to that is if somebody's going through an emergent situation, first thing that they need to do is call 911. And then once they've been cared for, then they can engage, and they can engage and see about getting that transportation covered by the VA. And then inter-facility transfers between the VA facilities and authorized community partners, that's an option there for veterans as well. The travel reimbursement. Now, if you've ever done a travel claim, this is going to look really familiar. For veterans that are driving to their appointments themselves, they've got that opportunity for reimbursement. Again, going back to the eligibility criteria, we look at some of the common carriers like Uber, Lyft, and taxis also on the table there, as well as public transportation. Additionally, some other expenses, road tolls, Easy Pass. with the pandemic and the toll by plate, those can be reimbursed for veterans as well. Parking and luggage. Some of the appointments that veterans go to may require them to travel a distance, and that could include an overnight stay. And then there's potential with that to incur some meals. So with pre-authorization, those can be covered for veterans as well. Automobile adaptive equipment for veterans, there's potential eligibility based on their medical needs to have a vehicle adapted to let them drive safely. You can see the list of some of the things that can be addressed in a veteran's car, to include lift equipment as well to get in and out of their vehicle. And it's an application ultimately to determine eligibility, and that's another resource that veterans, if they have the car, and it could be something just to have their vehicle adapted, can also help them get transportation to their appointments and even beyond the VA at that point. And then the last thing that I put in here, when I talk about the community clinics and the telehealth, we talk about transportation. You say, Jason, how does that really work? Obviously, the VA Medical Center in Lebanon is not right next door to everybody, and it puts VA resources and providers closer to veterans' homes, which means less time on the road and more convenience for our veterans. And there are still opportunities going back to the resources, the VTS program that could get veterans to the community clinic. So we also have our telehealth. Some of the appointments will allow our veterans to get and see their providers without leaving the comfort of their home or wherever they might be, make it more convenient and less time on the roads to get their care. I put up, based off of what I talked about tonight, a list of phone numbers for our subject matter experts here at the Lebanon VA. I wanted to make sure that this was available to everybody. The programs themselves oftentimes are very detailed, and what's important is that everyone's circumstances are not the same, and we want to make sure that communication is clear. So ultimately, if there's a question about a particular program and or eligibility, it's really best to talk to the people who deal with this day in and day out, and they're ultimately going to give you the best information on that. One other note, what I didn't necessarily cover today was the relationship with public transportation and community partners, but we do engage with them as well. I can't really talk in depth about that, but we certainly do that. And the presentation before was a great presentation about some of those options that are out there. And then the one last thing, I think, like it was said at the start of the presentation, that under voluntary services for myself, I have the volunteer transportation network, and we are always looking for volunteers. We are continuing to grow that base, and as we all look for volunteers, if you know of anybody that would be interested in becoming a driver for our program, we would be happy to talk to them and see if we can make that happen for them. And the one other thing there was a question in the chat about grants potentially being available to help with veterans transportation. We do have some contracts with I want to say Lyft and taxi, and we have an ability to utilize some bus transportation for veterans who are leaving the VA. So we do have some interaction that way. Most of what I'm familiar with is what is getting veterans to their VA appointments for their care here at the medical center. So, and if anybody's any questions, I'm certainly happy to try to answer them. That's all I have. Thank you.
Very good, Jason. Thank you for the information. If you would unshare your screen, please. I'm going to reshare mine. Okay, everybody, it is time for our second poll question, and I should be up on your screen right now. Please choose your answer and click submit. We are about to give you 10 to 15 seconds to make your selection. The question is, does your insurance qualify you for medical transportation? Yes, I use it regularly. I don't know. I go to the VA, but I'm sure about transportation, or no. Give you about 15 seconds here. Well, by the looks of the poll, it is pretty good that we're having this town hall tonight and providing some transportation information. 41% of the people say they don't know. 33% say that they go to the VA, but they're unsure about transportation. And 25% of the folks say no. So, like I said, good thing we're having this town hall and getting some information out there, everybody. Okay, we're going to move on to hear some information about rabbit transportation from Dr. Sherry Welsh. Dr. Welsh is a senior project manager at Susquehanna Regional Transportation Authority, administrator at rabbitcares, and owner of the Higher Climb Consulting Company, which is a champion for equity, access to the social detriments of health, and mobility as a fundamental right. Dr. Welsh has spent a large part of her career working in public transportation industry. Through her work, she has become heavily involved in various community groups and committees. Dr. Welch's focus has been on improving transportation services for marginalized populations, specifically for families with lower income, older adults, persons with disabilities, and veterans. Dr. Welsh, through her work with rabbitcares, seeks to secure financial resources to support transportation needs that fall outside of the traditional transportation funding streams. Dr. Welsh is an active member of the Healthy York and their Access and Empowerment Committee. She's the chairwoman, the Public Transportation Association, PPTA, Community Transport Committee, American Public Transportation Association, the Mobility Management Committee, York County's Welcoming Workplaces, and various coalitions that promote diversity, equality, inclusion, and belonging, and improve transportation services. Dr. Welsh holds a bachelor's and master's of social work from Millersville University, as well as a PhD in social work from Morgan State University in Baltimore. Dr. Welsh, I'm going to stop sharing my screen, and feel free to share yours and tell us all about rabbitcares.
All right, so just to start off, I know that you guys have so far talked about transportation from the state level and also from the federal level. And at this point, I'm going to talk about it more from the local level. And, you know, representing Rabbit Transit, as John Taylor did mention, we represent 11 counties, including Adams, Columbia, Cumberland, Dauphin, Franklin, Harrisburg, or Dauphin County, Montour, Northumberland, Perry, Snyder, Union, and York counties. So over the last decade or so, we have grown significantly from just the York County system. We are now providing service in an area that's equivalent to the size of the state of Delaware. So definitely growing. So I wanted to first take an opportunity to thank all of the veterans in the room for their service. It is definitely something that is important to me specifically. So I'm going to jump right in, and some of what I'm going to talk about is going to be very brief because John Taylor did such a fabulous job talking about the various types of services that are available across the state. And so being part of that same state, some of those services are going to be aligned with what we provide at Rabbit Transit. So again, I'm not going to go into a lot of detail, but fixed route service is one of our largest services. Again, as John Taylor mentioned, it follows the fixed route or follows a schedule that has a fixed schedule. And under that program, there are various different programs that were talked about already. We also offer a paratransit service, which again was also talked about. So I'm not going to spend a lot of time covering that. The next item is really our microtransit or stop hopper service, which was not mentioned so far. And this is a service that is really designed for specific zones. And if you live within those zones, the bus will pick you up at your home. But primarily, it's designed to be an extension of the fixed route service. So if you're getting off of a fixed route, it will take you a bit further within a local geo-fenced area. And when folks are using that service, it is operated similar to the way an Uber or a Lyft is operated, where you use a smartphone to schedule those rides and you can follow along with it the same way through that same technology. These are smaller van type vehicles, smaller than the typical paratransit vehicles that were mentioned earlier. Another service we offer is our express service, and this is a service that is designed similar to the fixed route service in that it follows a fixed schedule that's already designed and published into like a schedule booklet. But the difference with this is that it is really designed to travel longer distances, and so you would have fewer stops, making it an express service where it might go from York to Harrisburg, York to Maryland, or Gettysburg to Harrisburg. This service is traditionally designed for folks that are going to some of the larger, like going to the capital to work. So it's more designed for the working commuter. Again, this is just one more of the 4 types of service that we provide. So as John Taylor mentioned, the cost of transportation can be quite significant, and with that, many folks struggle to or cannot afford to fund the cost. And so with that being said, there's a huge need for there to be subsidy to come into play to assist people to really access the mobility options that are available. And these programs I'm not going to cover because John Taylor did a great job covering those, but these are the programs that really are the traditional transportation funding programs, the Senior Shared Ride program, the Persons with Disabilities programs, both of those funded by the Department of the PennDOT organization. There's also the MATP program through the Department of Human Services, the ADA program, and then the MHIDD program, as well as some of those smaller localized services that might come in to help to subsidize some of the programs that I've already mentioned, or even just subsidize trips on their own. So kind of where we start with new information is talking about the nonprofit organization that really was developed 4 years ago. So called rabbitcares. It originated through a grant that was designed to build inclusivity into the design of public transit. And so as part of that, we pulled together folks, persons with disabilities, seniors, and also veterans to help us to identify what the barriers are to public transportation. And from that, we then began to systematically work through those barriers. So at the end of the grant period that funded that initial project, we had a lot of success. And so we really opted to prevent the loss of the momentum that had been built through that program. We transitioned to a nonprofit organization. And so as part of that, we had to really identify what would be our priority populations. So what's nice about this program, so Pennsylvania is very fortunate in that we have a coordinated transportation system where we have a lot of amazing funding sources that are out there to cover the cost of transportation. But we do recognize that there are areas or populations that fall through the cracks of that. And so when we were looking at rabbitcares and trying to decide what our focus was going to be, we really tried to hone in on what some of the major need we were hearing through all of the conversation we were having with those folks we pulled together in the initial project. So when we did that, the areas that really came up were access to food, access to medical care, and then also access for veterans to medical care. So that really became the focus of the organization as a whole. So that really leads us to, why I'm here today. So we spent a lot of time trying to identify resources that would assist us in covering some form of coverage for veterans. And we were able to secure, initially it started as an access to medical care to the VA clinics, and this began back in 2016. So initially we started with the York County VA, and we were given some seed money to really start this program. And so over time now, since 2016, we have been able to expand to 10 of our counties to get them to access to medical care to the VA clinic in Lebanon. Now, the only area where we're lacking in our 11 county region in terms of medical transportation is to get folks to West Virginia for Franklin County, where the majority of the folks who live in that region travel for their medical care to the VA clinic. So, but in any case, so for now, we do offer free veterans medical transportation to get to the VA clinic. And that is, as I said, it is free for folks. It's done via a shuttle. For folks that are not able to get to the shuttle, we do provide paratransit service to get them from their home to the shuttle location and then to get them to the VA clinic. And all of that is free. Now, what we do in that process is we do try to transition folks if there are existing programs that are already subsidized, such as the Senior Shared Ride program or the Persons with this, I'm sorry, not that one, but MATP or the ADA programs. We do try to get folks onto other programs so that we can further extend the life of the various grants and such that we're able to receive for veteran-specific programming. About 2 years ago, we were able to add to that program of access to employment, because that began to be something that we really heard a lot about. Now, that started right before COVID, so we have not seen a huge use of this program. I'm hoping as COVID transitions further, like the major part of COVID transitions out in time, that we'll begin to see more usage of that program. But using the employment transportation program, that is really a fixed route service. So the way that that's designed is for someone who applies for the program, we will provide them with a pass, an initial 11 ride pass to get folks to and from job interviews. Then once someone secures a job, then the first month we would provide them with a free monthly pass that they would be able to use not only for employment, but for whatever resources, wherever they're going. And of course, that's going to be available in the counties where we have a fixed route. So much like John Taylor mentioned earlier, in the areas where there's more dense population, that's where you're going to have that fixed route service. So there is a gap in that program. So we're hoping as we move forward that we're able to find other solutions for the areas that are more rural in nature. So anyway, as that program continues for an individual on it, then it kind of prorates. So the first month is free for the veteran. The second month, the veteran would pay 25% of the fixed route pass. The third month, they would pay 50%. The next month, they would pay 75%. And then the last month of that program, they would be now receiving that, they would pay 100%. So it's designed to get to self-sufficiency once someone receives employment. So really, to access these programs, there's 5 essential steps that would get someone into these programs, and that is really to apply for the service first, to book the trip, and then there's some preparation just in terms of, letting us know where you're going. Obviously, in this case, you're going to the VA clinic. You would get your pickup times and things like that. You would ride and then plan for your next trip. So that's really the 5 steps of using public transit, specifically the paratransit service in our service area. So as I had mentioned, in terms of the cost, the employment transportation, that is really a subsidized type of service where the rider pays 0%, 25%, 50, 75, and then 100. And the medical transportation program is free for the rider. It's funded for the cost of the various grants that we have received so far to cover that program. So much like any nonprofit organization, we do always point out that, this is a free service for veterans, but we are always trying to receive donations to continue to fund this program because we never know with the nature of competitive grants, we never know if those grants will stop or we won't be selected. Thus far, we've been very, very successful, but you never know. So just kind of a general overview, medical transportation, the employment transportation. And that is pretty much it for now. So if folks have questions, I'd be happy to answer them.
Dr. Welch, thank you very much for that information. And we will certainly here at DMVA help you promote Rabbit Transit through our weekly digital digest that we put out. Just if you would shoot me some information on what you'd like to get out, and we will certainly get that out for you.
Absolutely.
Okay, now we're going to do our poll question number 3. So when that comes on, read the poll question, choose an answer, and then click submit. We'll give you about 10 to 15 seconds to make your selection. Okay, we either have a lot of knowledgeable people in the audience tonight or some good guessers. The answer is, in fact, 1/3. So thank you for that. We're going to take just a couple seconds here so that Corey can get the 4th and final poll question loaded. But I just wanted to make a comment that due to the size of Pennsylvania and the ruralness of it, DMVA has determined 5 kind of trouble areas for veterans out there. And one of those 5 trouble areas is transportation. So DMVA, working in coordination with the Governor's Advisory Council for Veteran Services, are out there trying to find unique ways for us to find transportation services for veterans. Through our program called PA Vet Connect, we have the state divided up into 5 regions, and in each of those regions is a regional program outreach coordinator. Those regional outreach program coordinators go out in the community and find resources for veterans. And while they're out discovering resources for veterans, they are also looking at transportation initiatives out there that we can put into our PA Vet Connect resource and information tool. So we're out there looking for unique transportation opportunities as well. Corey, we're ready for poll question number 4. Take about 15 minutes or 15 seconds to answer the question. The question is approximately how many in 10 veterans live in rural areas where transportations are often limited? Okay, it looks like everybody's pretty well responded to it. And once again, you're all correct. 4 out of 10 veterans live in rural areas where transportation options are often limited. So thank you for participating in the polls tonight. Susan and Zach, do we have any questions in the chat panel that we haven't answered yet?
I don't see any questions that haven't been answered, but I did want to mention that there is a note in here that veterans who have their own vehicles, if you qualify for a handicap placard, you should contact your state representative or state senator offices so that they can help submit that paperwork through PennDOT. And also just a reminder, if you are a disabled veteran, that you have the ability to file for disability veteran license plate or placards, and that can be done with assistance through your county director of Veterans Affairs.
Okay, if does anybody have any questions out there that we can possibly try to answer for you tonight? All right, seeing none, I would like to remind you all that you should be seeing a link to the post-event survey in the chat box. We're asking that you, before you log off, you click on the link and complete the survey. It will take you to a form with a few questions to gather some feedback on the town hall. If for some reason you feel that your question wasn't answered or you didn't feel comfortable about putting it in the chat panel, please reach out to us at our resource account. And the resource account is currently on the screen right now. A member of the PA Vet Connect staff will monitor it every single day, and we will try to answer those questions within 3 business days if you put a question in there. You can also contact our office, and we will try to answer any questions we can for you. Ma'am, do you have anything further for us tonight?
I do. First, I want to say thank you to all of our panelists. That was really great information. I appreciate all of your time, taking the time out to educate these veterans, veteran advocates. I see so many people on the line, and I want to let you know, I want you to take PA Vet Connect and write it down. I would also ask all of you, whether you're a veteran caregiver, or an advocate or a veteran service officer, please go to PA Registry. Sign up, go to PA Vet Connect, and then go to our registry. We send out information every Wednesday. We just sent one out a few hours ago, yesterday, giving you all the new information, talking about the PAC Act, the legislative changes, benefits, claims, and this is a way for you to reach out to all of us. Please don't let today be the last time you talk to us. Our team is here for you. The Department of Military and Veteran Affairs, our job is to facilitate and advocate veteran initiatives and to make sure all of you are taken care of. So please reach out to us. Let us know what you need. I'm sure you have other questions. We've had town halls on aging and issues with long-term care facilities and options for veterans. We've had it on behavioral health. We're having it on transportation. Please don't be afraid to ask us any questions. We are here to take care of all of the veterans across the Commonwealth. PA Vet Connect, Google it. You will find ways to reach all of your county directors, your veteran service officers, and our office, and then sign up for the registry. It's a way to help. So please don't be shy to ask us questions and reach out. Today's just an initial conversation. We want to be here for you. And I really thank all of you for your time. And I thank Chip and the team for putting this together. So thank you all. Thank you for your service, for those who served, and God bless you all. Thanks.
Hey, thanks for those final comments, Mim. Also, at this time, the rest of us would like to thank everybody for joining this evening, all the attendees, and especially our subject matter expert panelists, our veteran advocates, and our veterans that joined us tonight. Please join us in November for our 5th and final town hall. It is honoring our Pennsylvania veterans, so please join us for that. Again, thank you all for joining, and I hope you have the great rest of your evening.
Hey, Chip.
Hello. Yes.
Hey, this is Jason. I'm sorry.
Hey.
Sorry to jump in there. There was a question about special mode in the chat that I didn't get to answer. It asks about if they're aware, if it's not approved, if veterans know to submit it potentially to their own private insurance. If there's special mode that's provided to an appointment, that is going to be covered by the VA. If the reference is to an ambulance, then it's not approved, then they would certainly have that opportunity to submit it to their own private insurance to cover that. And then one other question with respect to telehealth, if it could be conducted at their local VA clinic, that will be something for whatever their appointment they're having. If their local clinic would have a space available for them to potentially do the appointment that way. That's the best answer that I have right now, but I can also dig down on that and get back to you to share with the group that if I get anything else.
Okay, Jason. Very good. Thank you very much. Does any member of the team have any final comments? All righty then, folks. Well, like I said, thank you for joining us tonight. We hope you have a great rest of your evening, and please join us in November for our 5th and final town hall. Have a great evening, everybody.